Hi everyone, my name is Sonal, and today I'm going to be presenting on the symposium about the effects of socioeconomics on nutritional health. So, a little background as to what inspired me to create this idea is the warehouse that I work at. So, I volunteer at a warehouse in which we package foods and then distribute them, or we distribute packaged foods put together, such as beans or rice, and a couple of other snacks or any sort of packaged foods that maybe some standard foods that lower income people may not be able to afford from their local grocery store. So, we put them together in these nice bags and we send them off to families who may need them. I also work in a program, this is the main program that I work in, and it's the one that we help prepare meals and we actually cut the fruits and vegetables and prepare all the meats so that they can be cooked and then we can serve them directly to all of the people who are lower income or who may be homeless, whoever comes into the center to get these free meals. So, a little bit about me right after that is that I'm 17. I am going to graduate very soon. And thank you so much to my mentor for helping me out with this project. So, let's get started. All the contents on here have been explained in more detail in my research paper. And these slides are here just as a little bit of a guide in case you may get a little bit lost in what I'm saying. Most of everything that I'm talking about, a good summarization is on the current slide that we're on. Okay, so I'm going to be doing most of the talking. If you ever need to figure out what I'm talking about, most of the information is also on the slide. Okay? Okay. So first of all, there are different socioeconomic and cultural backgrounds. Of course, different cultures may mean different diets, and different faiths may also lead to different diets and people getting certain nutrients and not getting certain nutrients. It varies very much. And of course, so when we think about socioeconomics, or social classes, we may think of these three very basic ones. Of course, each of them has their own branches and has many different definitions that you can think of. But there's generally higher income or stable residents or financially stable residents. There may be lower income residents and there are the homeless. So these are some examples of higher income careers. So when we think of higher income people, we may think around these sort of careers. Again, these are very simple ones. There are many careers out there who may be considered higher income, but these are just some simple ones that I came up with. I'm sure you're thinking of a different one from this list right now. But we have orthodontist, doctor, engineer, computer information expert, or data scientist. Of course, each of these, they have their own branches and many different careers as we have a lot of these days. So I'm sure you could think of many other ones. Okay, so these are some different benefits that higher income families may have. So some companies, people are able to get health insurance through them, which reduces a certain amount that they might have to pay or certain commitments that they may have to make. So it saves them time and it may save them money. They can afford gym equipment or membership to stay healthy. Again, this one may seem like a bit of a simple one, like how is this related to nutritional health? Well, a lot of the times they may not be necessarily thinking about the exact nutrients that they're eating, right? So, they just eat and eat and they eat. They may be eating healthy foods, they may be eating unhealthy foods. But regardless, it's important that, we stay in shape and exercise, right? And maybe people of higher income are able to afford a gym membership. And let's say lower income and higher income people, they may be eating the exact same thing. Let's say they're both eating lots and lots of fast food, but the difference is maybe higher income family or higher income earning person, they may be able to go to the gym and work off as much as they can, or just stay in a healthier shape because they have that. And some can also afford a dietitian or health experts to help them navigate regardless of what kind of health issues they have. And another one is affording school meals, for their kids. If it may be more convenient, they may be able to pay the school to give their kids a meal. And it may save them, again, some time. Okay, so these are some examples of lower income jobs. So the biggest topic that I could come up with right on the moment was blue collar workers. Of course, there are many other jobs, but within blue collar workers, there are different jobs. There are construction workers, there are drivers, there are also manual labor workers. So this is a little bit more about blue collar jobs since it's a pretty it's a pretty common broad topic that we may think of when we think of low-income jobs. So their unbalanced diet may also lead to a higher rate of diabetes or cardiovascular disease. And research has also shown that there's a smoking prevalence among blue-collar workers, which is a health effect that they may have that is definitely not good for them. Smoking can lead to lung problems, including cancer, for which treatments are very expensive and also physically exhausting. And since a lot of blue-collar jobs require physically fit people to do them, maybe having a lot of treatment or having things that are physically exhausting, it may kind of tone them down, and it won't necessarily be good for them because they won't be able to do their jobs properly, maybe not to the fullest. So these are some more effects of lower income families. Um, so some effects on their lifestyle, there's more stress upon them as they may be earning lower income and they may be feeling like, oh, I'm not able to afford everything that I should be. And wage earning families who also work in small companies and businesses may not have access to health insurance or even sick days. Think about it. Smaller businesses, maybe the owners, they might, in order to run them all the time before they may turn into something bigger, they need to be working all the time. So it's really hard to be able to give sick days or off days to people, or even vacation days. So this in turn leads to employees having less time for their children, less time for their family, and less healthcare options to manage potential health problems. They may not be able to stop a health problem from the root of it before it becomes bigger and also more expensive. Because again, health problems, they can be unpredictable. Sometimes they may stop or sometimes they may come back. Another one is very important, commute to grocery stores. The larger the distances from a home to a store, the more money that has to be spent on transportation to get there. These days, especially gas is money, right? So lower income neighborhood may be a little bit farther away from really good and healthy markets and grocery outlets. Right, and wealthy, richer areas may have easier access because that's typically where people, if they want to build a huge market, they may build it in a wealthier area because it may attract more customers, right? And this generally makes it a large commitment for those who may be living in lower income neighborhoods. Again, financially stable, they continue to stay stable because they may not have to spend as much on going to the grocery store because it's very affordable for them and it's built closer to them. So these are some alternatives that lower income families use. So because of the commute, they might find it easier if they have a nearby, just very close fast food restaurant. But fast food meals typically contain more calories, fat, sugar, salt, and processed ingredients, which aren't really good for them. As I mentioned earlier, it's important that people have very balanced meals. It's what we learned from our head chef at the center where I prepare meals. And a lot of people, in order to regulate their health, they may need it, and they may not even realize how important it actually is for them to have well-balanced meals. So foods, even if they prepare food at home, they may use a lot of foods such as milk, cheese, or milk as a drink, but cheese, pizza, lard, or pork skin, and they contain large amounts of fatty acids. Too many fatty acids without other foods, such as fruits or vegetables, to balance them out can lead to detrimental health issues. Again, not necessarily the milk, cheese, or pizza is a problem. The problem may be that there is no huge thing balancing it. There are no fruits and vegetables to balance it. So these are some potential solutions that I want to look into. Farmers markets are more convenient for communities, and research has provided the conclusion that counties with more farmers markets available have less populations of people with poverty and also less obesity. And also, there should be more free meal centers, just like the ones that I work at, and also closer to lower income neighborhoods. I think that this would be a really good resource. And farmers markets, they typically also should be closer to lower income neighborhoods since they also sell a lot of items such as fruits and vegetables and things that are freshly produced. And also, in turn, the proceeds, they cut out the middleman of having to drive it and package it, and they give it directly to all the people who are farming it. So these are some really good solutions and things to keep people's nutritional health in check. And I think, this is a really good way to get the word out there. And this is just kind of my way of emphasizing how socioeconomics can really affect people's nutritional health. Again, there is a lot more on my research paper about this, but this is my presentation. And I talked a lot about socioeconomics as well. Thank you so much for listening to my presentation. And And I hope that this could emphasize more of this topic for you, and you were able to get a really good idea of what may or may not cause nutritional effects, good or bad, on people in this world. Thank you.